Welcome to this deep dive. Today, we're getting into arthritis treatment and pain management.
That's right.
Whether you've lived with arthritis for years or maybe you're just starting to feel some of those, joint twinges, our goal here is simple.
We want to pull out the key advice, the really useful insights to make living with it that bit easier.
Think of it as your shortcut, to understanding how to manage arthritis better.
And it's such an important topic. I mean, arthritis affects millions, especially as we get older.
Right.
And it's not always just minor aches. For a lot of people, it can cause significant pain that, really gets in the way of daily life.
But there's good news too.
Absolutely. That's key. Effective management is definitely possible. We want to make that clear right from the start.
Exactly. So in this deep dive, our mission, if you like, is to share expert strategies. We'll talk about tackling pain, understanding inflammation, how to reduce it.
And lots of practical, actionable tips too.
Yeah, covering everything from medications to things like exercise, lifestyle changes, basically things that can genuinely boost your quality of life.
The aim is really to equip you with the knowledge you need.
So arthritis doesn't stop you from enjoying those daily walks or time with family or, your favorite hobbies.
Okay, so let's unpack this a bit. When we say arthritis, what are we actually talking about?
Good question. It sounds like one thing, but it's not really, is it?
Not at all. Arthritis is more of an umbrella term. It covers over 100 different conditions.
Wow, over 100.
Yeah. But the common thread is they all affect the joints. They cause inflammation, pain, stiffness, swelling. The drill.
And typically in places like knees, hips, fingers.
Knees, hips, fingers, those are very common spots. Really, any joint can be affected. Understanding that variety is pretty crucial.
It really is quite a mix. So what's the biggest confusion people have, say, between osteoarthritis and rheumatoid arthritis?
That's a great one. People often just say arthritis without realizing the mechanisms behind them can be, worlds apart. Let's focus on the types most common in older adults.
Okay.
First up, osteoarthritis. OA. Think of this one like the tread on your car tires wearing thin over time.
Okay, a mechanical thing.
Exactly. It's mainly a wear and tear issue. The cartilage, that cushion in the joints, it gradually breaks down, and unfortunately that damage isn't really reversible.
So management is about slowing it down. And symptoms.
Precisely. Slowing progression, easing the pain and stiffness. It gets more common after 50, and often hits the knees, hips, hands.
The joints we use all the time for walking, stairs, gripping things.
You got it. Makes all those things harder.
So OA is that gradual physical wearing down. But then rheumatoid arthritis, RA, that's completely different, I gather.
Completely different piece. RA is an autoimmune disease. So here, your body's own immune system makes a mistake.
It attacks itself.
It attacks the synovium, that's the lining inside your joint capsule, the part that makes the lubricating fluid. In RA, the immune system targets that lining. This causes inflammation, and over time, it can lead to pretty significant joint damage.
And what triggers that?
Well, it's often a mix. There can be a genetic predisposition, but environmental factors might set it off, things like infections or even smoking.
Interesting. And RA often affects both sides, right? Both knees or wrists.
That's a key feature, Symmetrical involvement. And it typically involves flare-ups where symptoms get worse and then periods of remission.
So early treatment is vital for RA.
Crucial. To prevent that long-term joint damage, you need to be quite aggressive with treatment early on.
Okay. And then there's gout. People might not immediately think arthritis with gout.
But it definitely is. Gout happens because of a buildup of uric acid crystals in the joints.
Little shark crystals, right?
Exactly. They often show up first in the big toe. That's the classic starting point. But other joints can be affected too.
And diet plays a big role.
A significant role. Foods high in purines, think red meat, shellfish, they break down into uric acid. Dehydration can also be a trigger, along with other medical conditions.
And a gout attack is memorable, I hear.
Oh, anyone who's had one won't forget it. It's sudden, extremely painful, often strikes at night. The joint gets hot, red, swollen, incredibly tender to touch. Very distinct.
Okay, moving on. Psoriatic arthritis, PSA. How does that fit in?
PSA is another inflammatory type. And like the name suggests, it's linked to psoriasis, the skin condition.
Right.
So people with PSA get joint pain, swelling, stiffness, often in the fingers, toes, even the spine. It's also autoimmune. The psoriasis is a big clue for doctors.
And it impacts quality of life quite a bit.
It really can. Both from the joint issues limiting movement and dealing with the skin rashes too.
And lastly, ankylosing spondylitis. That one mainly affects The spine.
Primarily the spine, yes. It causes inflammation there, and over time, the vertebrae can actually start to fuse together.
Wow, that sounds serious.
It can be. It's seen more often in men, typically starting under the age of 40, and genetics seem to be a big factor. It can really limit mobility in the lower back, and in severe cases, lead to a rigid spine.
So looking across all these different types, what are the common threads? What increases the risk for older adults in general?
Well, the biggest one, honestly, is just age. Our cartilage naturally wears down, and our body's repair systems aren't quite as good as they used to be.
Makes sense.
Then genetics, like we mentioned for RA and ankylosing spondylitis, if it runs in your family, your risk is higher.
Past injuries too?
Definitely. A significant joint injury earlier in life can set the stage for arthritis later on. And unfortunately, obesity is a major one.
Because of the extra weight.
Exactly. All that extra stress on the weight-bearing joints, knees, hips. Lifestyle also plays a part. Smoking, poor diet, not enough exercise. Those can increase risk, especially for the inflammatory types. And finally, gender. Women tend to be more prone to both RA and OA, particularly after menopause.
Which leads to the big question. Can you actually prevent arthritis? Is it avoidable?
Well, you can't guarantee prevention in every single case, but you can absolutely take steps to significantly lower your risk.
Like what?
Regular exercise is huge. Keeping joints flexible, strengthening the muscles around them, maintaining a healthy weight that's critical for knees and hips.
Avoiding injuries.
Right. Using proper technique during activities, protective gear when needed. Eating a healthy diet, especially anti-inflammatory foods like those with omega-3s, can help.
And quitting smoking, especially for RA risk.
Absolutely essential if you smoke. It's a known trigger for RA.
So understanding all these types and causes, how does that actually help when it comes to treatment?
It's fundamental, really. Knowing which type of arthritis you have, is it the wear and tear of OA or the autoimmune attack in RA, tells doctors which treatments are likely to work best.
So they can target the specific problem.
Exactly. Target the immune system in RA. Focus on managing cartilage loss and pain in OA. It allows for a much more tailored and ultimately more effective approach.
Okay, now that we've got a handle on the different kinds of arthritis, let's talk about spotting it. What are those first signs, those symptoms you might notice?
The most common starting point is usually joint pain. Could be mild, could be sharp, just an ache.
And it gets worse with movement or after resting.
Often, yes. Worse with movement, especially after you've been inactive for a bit, or maybe after you've overdone it. You know, that knee pain after climbing stairs, or fingers aching after gripping something for a while.
Swelling is another one, right?
Yeah, joint swelling is common, particularly with inflammatory types like RA. The joint might look puffy, feel warm, maybe even look a bit red.
And that morning stiffness?
Well, the classic morning stiffness, or stiffness after sitting for a long time. It can make it really hard to get moving freely, like trying to get out of bed when your knees or hips just feel locked up.
And it's not always just about the joints themselves, is it? There can be other symptoms.
That's true. Reduced range of motion is a big one. Over time, you might find you just can't bend or straighten a joint like you used to.
Making everyday stuff harder.
Exactly. Things like getting dressed, reaching for things on a high shelf, and fatigue. That's a really common one, especially with inflammatory arthritis like RA.
Why fatigue?
Well, it could be the body's immune response using up energy, or just the drain of being in chronic pain. You feel unusually tired, even after doing normal activities.
And you mentioned warmth and redness with swelling.
Yeah, particularly in types like RA, the inflammation can make the skin around the joint feel warm to the touch and look red.
So with these kinds of symptoms cropping up, when should someone think, okay, I need to see a doctor about this? What's the trigger point?
It's really important not to just brush it off as, getting older. If you have pain or stiffness that just sticks around, doesn't get better with rest, or maybe some over-the-counter stuff.
That's a flag.
Definitely. Or if the pain starts getting in the way of your daily life, walking, working, doing chores, that's a clear sign to get it checked out.
What about swelling or redness?
Any unexplained swelling, redness, or warmth in a joint that just doesn't go away needs a look. Same if you find you really can't move a joint properly, or your range of motion is limited enough that it's affecting how you function.
And the fatigue.
If you got significant fatigue, or just feel generally unwell alongside the joint pain, especially if you suspect an inflammatory type that warrants a visit.
Anything else really serious?
Yeah, if you have joint pain along with things like a fever, unexplained weight loss, or a rash, that could point to a more serious underlying autoimmune condition, so definitely seek medical help promptly.
Okay, so you go to the doctor. What happens next? How do they figure out if it is arthritis and which type?
Well, it usually starts with a good chat. Your medical history.
Symptoms, when they started, family history.
Exactly. When did it start? Which joints hurt? How bad is it? Does anyone in your family have arthritis? All that. Then comes the physical exam.
Checking the joints themselves.
Right. Looking for swelling, redness, warmth, any deformities. They'll also test your range of motion, see how well you can actually move those joints.
And blood tests.
Often key. They might look for things like rheumatoid factor or RF and anti-CCP antibodies. Those are often markers for RA.
What about inflammation levels?
Yeah, they can check C-reactive protein, CRP, and ESR, the sedimentation rate. High levels suggest inflammation somewhere in the body.
Imaging tests, too, like x-rays.
Very common. X-rays are good for showing joint space narrowing, bone spurs, or damage typical of OA or RA.
What about MRIs or ultrasounds?
MRI gives a much more detailed look at soft tissues, like cartilage. Ultrasound can be really good for spotting inflammation or fluid buildup in real time.
And sometimes they test the joint fluid itself.
Yes, especially if they suspect gout. They can draw a little fluid from the joint and look for those uric acid crystals under a microscope, or check for other inflammation markers.
Okay, so after all that, the big question on everyone's mind is probably, can these symptoms actually be managed? Can you get relief?
Yes, absolutely. That's the crucial message. While a cure might not be on the table for most types, arthritis symptoms can definitely be managed, often very effectively. It takes a comprehensive approach, usually a mix of medications, physical therapy, lifestyle changes, and sometimes, in more severe cases, surgery.
And early diagnosis helps.
Hugely. Getting that diagnosis and starting a management plan early gives you the best chance of controlling symptoms and preventing further damage.
Right, let's dive into those treatments then. What about medications? What are the common ones doctors might use?
Okay, medications. They often play a big role. You've got your basic pain relievers, over-the-counter NSAIDs like ibuprofen, naproxen. They help with both pain and inflammation.
What about Tylenol, acetaminophen?
That helps with pain, but it doesn't really tackle inflammation. So it's often better for milder pain, maybe an OA.
And for bigger flare-ups?
For significant inflammation, doctors might use corticosteroids like prednisone. Powerful anti-inflammatories. You can take them as pills or get an injection right into the joint.
More targeted relief.
Exactly. Then for the autoimmune types like RA, you have DMORDs, disease-modifying anti-rheumatic drugs.
Like methotrexate.
Methotrexate is a common one, yeah. Hydroxychloroquine, too. These actually work to slow down the disease itself and prevent joint damage. They're really important.
And the newer drugs? Biologics.
Right, biologics.
Yeah.
These are more targeted. They go after specific parts of the immune system that are driving the inflammation in conditions like RA. You might have heard of TNF inhibitors, like Humira. That's one type.
So that's the medication side. What about non-drug treatments? What else helps manage arthritis?
Oh, non-medication approaches are absolutely vital. Physical therapy is a huge one.
Exercises and stuff?
Yes, specific exercises tailored to you to improve strength, flexibility, mobility. A good physical therapist designs a program to reduce your pain and help protect your joints.
What about simple things like heat or cold?
Classic remedies, and often very effective. Heat, like a heating pad or warm bath, is great for easing stiffness, improving blood flow. Cold, like an ice pack, is better for reducing inflammation and kind of numbing the pain.
When would you use each?
Maybe heat for morning stiffness, cold for swelling after you've been active. About 15-20 minutes for either.
Makes sense. What about occupational therapy?
Occupational therapy is fantastic.
Yeah.
They help you figure out how to do daily tasks more easily, maybe using assistive devices or learning different techniques to put less strain on your joints, like special jar openers or tools with thicker handles.
Practical help. And massage.
Massage therapy can feel really good. It helps relax those tense muscles around the joints, improves blood flow, and can definitely help ease pain and stiffness for some people.
It really sounds like our everyday habits, our lifestyle plays a massive role here.
Oh, absolutely fundamental. Lifestyle changes are key. Regular exercise, but the right kind of exercise.
Low impact stuff.
Exactly. Swimming, walking, cycling. Things that keep you moving and maintain strength without pounding the joints. Weight management is also crucial.
Especially for knees and hips.
Right. Extra weight just means extra pressure. Even losing a small amount of weight can make a surprising difference in pain levels.
And diet again.
Yep. Diet matters. A balanced diet, focusing on those anti-inflammatory foods we talked about, the omega-3s in fish, nuts, seeds, lots of fruits and veggies.
Avoiding processed stuff.
Generally a good idea. Less processed food, less sugar. And managing stress is important too.
How does stress affect arthritis?
Stress can actually trigger or worsen inflammation and pain. So finding ways to relax, yoga, deep breathing, meditation, whatever works for you, can genuinely help manage your arthritis symptoms.
Now, what if things are really severe? If these other treatments just aren't cutting it, are there surgical options?
Yes, for severe arthritis, where the damage is extensive and pain isn't controlled, surgery can be an option.
Like joint replacements.
Joint replacement is the big one, especially for hips and knees in severe OA. Replacing the damaged joint with an artificial one can bring dramatic pain relief and improve mobility.
What about less invasive surgery?
Arthroscopy is a minimally invasive option. They use small incisions and a camera to go in and, say, remove damaged tissue or smooth out cartilage, often used for knees and shoulders.
And joint fusion, that sounds intense.
It is a bigger procedure. Joint fusion, or arthrodesis, permanently joins the bones of a joint together. So you lose movement at that specific joint, but it can eliminate pain. It's sometimes done in the spine, ankle, or wrist in specific cases.
Okay, let's tackle a question I bet a lot of listeners have. Can arthritis actually be cured? Like completely gone?
That's the million-dollar question, isn't it? And, well, right now, the honest answer for most types of arthritis is no, it can't be cured completely.
Right.
And this is it can absolutely be managed effectively. Very effectively.
So people can still live well with it?
Absolutely. With the right combination of treatments, lifestyle changes, you can manage the symptoms, keep active, and live a full life. The focus really shifts from cure to effective management and maintaining joint health.
Okay. Let's talk more about exercise. We mentioned low impact, but what specific types are generally best and safest?
Right? Exercise is crucial, but you need to be smart about it. Low impact is the way to go. So walking is great. Swimming, cycling, water aerobics, fantastic, because the water supports your joints.
What about flexibility?
Also key. Range of motion exercises help maintain movement. Gentle stretching, yoga, tai chi, those are excellent for improving flexibility and reducing that stiffness.
And strengthening.
Yes, strengthening the muscles around the joints helps support them. You don't need heavy weights. Light weights, resistance bands, that can do the trick.
So it needs to be personalized.
Definitely.
Perfect.
The best thing is to work with a physical therapist or your doctor. They can help you create a plan that suits your specific type of arthritis and fitness level, making sure you don't overdo it and stress the joints.
We keep coming back to diet. Can specific food choices really help manage the pain aspect of arthritis?
Yes, diet can definitely play a supportive role. The main idea is to lean towards anti-inflammatory foods.
Like the omega-3s.
Exactly. Fatty fish like salmon or mackerel, flax seeds, walnuts, load up on leafy greens, berries, things like broccoli. Olive oil is a good fat source.
And what should people try to limit?
Generally, it's helpful to cut back on processed foods, sugary drinks, refined carbs like white bread, and maybe excessive red meat. Some people find dairy can be a trigger too, but that varies.
So maybe work with a professional.
Yeah, talking to a registered dietitian or nutritionist could be really helpful. They can help you figure out a plan that works for you, your tastes, and your specific needs.
Okay, beyond the core stuff like diet and exercise, are there other natural ways people can try to get some relief at home, complementary things?
Yeah, lots of people explore these. Turmeric and ginger come up a lot. They have natural anti-inflammatory properties.
How do people use them?
You can add them to cooking, make teas, or take supplements, though. Check with your doctor about supplements. Some find topical capsaicin cream helps that's derived from chili peppers.
Interesting. What else?
Epsom salt baths can be soothing, potentially due to the magnesium. And some people find relief with things like acupuncture or massage therapy.
Important to talk to your doctor first, though.
Always,
Yeah.
especially if you're considering adding something new, like a supplement, alongside your existing medications. You want to make sure it's safe and won't cause any interactions.
Right. And one last question in this section, prevention. We touched on reducing risk, but can you actually prevent arthritis from ever starting?
Well, you can't guarantee it 100%. There are factors like genetics you can't change, but you can definitely stack the odds in your favor.
Ow.
Maintaining that healthy weight is probably the single biggest modifiable factor for osteoarthritis, especially in the knees and hips. Regular, appropriate exercise keeps joints healthy. Protecting your joints from injury is important. Proper form, safety gear, and eating that healthy, balanced diet contributes to overall health, including joint health.
Okay, let's pivot back to some practical things people can do right at home. Those accessible remedies for pain relief. What are some easy wins?
Heat and cold therapy. Super simple, often really effective.
Heat for stiffness.
Yeah, heating pad, warm bath, hot water bottle. Great for morning stiffness or just relaxing muscles after activity. About 15-20 minutes usually does it.
And cold for?
Cold packs, always wrap them in a cloth. Don't put ice directly on the skin. Are great for reducing swelling and numbing acute pain, maybe after you've done a bit too much. Again, 15-20 minutes.
We mentioned turmeric and ginger as anti-inflammatories. How can people actually use those easily at home?
Right. Turmeric contains curcumin, which is the active compound. You can just add turmeric powder to curries, soups, rice, even blend it into smoothies, or make golden milk with warm milk and spices.
And ginger?
Ginger's great too, especially reported for OA pain. Make fresh ginger tea by steeping slices in hot water, grate it into stir-fries or soups, or again, consider supplements after checking with your doctor.
Okay. And what about Epsom salt baths? What's the thinking behind those?
They're a popular home remedy. Just dissolve about 2 cups of Epsom salt in a warm bath and soak for 15-20 minutes. The idea is the magnesium sulfate gets absorbed and helps relax muscles, reduce swelling, and ease pain. Whether it absorbs well is debated, but many find the warm soak itself relaxing.
Makes sense. What if muscle tension is a big part of the pain picture? Anything to do at home for that?
Gentle massage can really help. You can do self-massage on accessible joints, or maybe get a partner or family member to help with areas like the back or shoulders. It boosts blood flow, eases tension, can improve flexibility a bit.
Acupressure too.
Some people find acupressure helpful. That involves applying gentle, firm pressure to specific points on the body thought to relieve pain. There are maps and guides you can find, like the LI4 point between the thumb and index finger.
And obviously, tying it all together, the general home lifestyle stuff is still key, right?
Absolutely. It all works together. Maintaining that healthy weight through sensible eating and low-impact exercise reduces joint stress day in, day out. Focusing on that anti-inflammatory diet pattern, lots of plants, healthy fats, lean protein.
And rest.
Crucial. Getting enough good quality sleep is important for managing pain and overall health. And finding ways to relax and manage stress, mindfulness, deep breathing, yoga, meditation, helps calm the nervous system and can reduce the perception of pain.
Okay, so that covers a lot of what people can do themselves. But let's shift now to when those things aren't enough. When medical treatments for more severe arthritis are needed, what options come into play then?
Right. When things get more severe, the medical toolkit expands. You might move to prescription-strength NSAIDs like celecoxib. They can be more effective, but you need to be mindful of potential long-term risks like stomach issues or cardiovascular effects.
And corticosteroids again.
Yes, corticosteroids like prednisone are powerful for knocking down severe inflammation, especially in RA or gout flare-ups. Usually given orally or by injection, but typically only for short bursts because of side effects with long-term use, weight gain, bone thinning, increased infection risk.
Then the DMARDs and biologics we mentioned earlier become even more critical.
Exactly. For inflammatory types like RA or PSA, DRs, methotrexate, sulfasalazine, hydroxychloroquine are often the mainstay. They work on the underlying immune process to prevent joint damage. They do require regular blood tests and monitoring for side effects like potential liver issues or effects on blood counts.
And biologics.
Biologics like etanercept, adalimumab, and infliximab are often used if DMARDs aren't effective enough or sometimes in combination. They're very targeted therapies, blocking specific inflammatory pathways. They can be very effective but also carry an increased risk of infections, so careful monitoring is needed.
What about treatments delivered directly into the joint? Injections.
Yes, joint injections can provide very focused relief. Corticosteroid injections, as we said, offer fast, powerful anti-inflammatory effects right where you need it. Good for OA or RA flare-ups, but usually limited in frequency per year to avoid potential cartilage damage.
What about other types of injections? Hyaluronic acid.
Hyaluronic acid injections, sometimes called viscosupplementation, are mainly used for knee OA. The idea is to supplement the natural joint fluid, providing lubrication and cushioning. Relief can sometimes last for up to 6 months.
And PRP, platelet-rich plasma.
PRP therapy is gaining interest. It uses concentrated platelets from your own blood injected back into the joint. The theory is the growth factors in the platelets stimulate healing and reduce inflammation. Still being studied, but it's an option some clinics offer.
And if the joint damage is really bad, limiting life significantly, that's when surgery comes back into the picture.
That's usually the progression, yes. When non-surgical treatments aren't enough and the joint damage causes severe pain and disability, surgery might be the best option.
Joint replacement being the most common.
For severe OA of the hip or knee, definitely. Shoulder replacements are also done. It can provide significant pain relief and restore function, really improving quality of life.
And arthroscopy or fusion as other possibilities.
Right. Arthroscopy might be used for less severe damage to clean out debris or repair tears. Fusion, or arthrodesis, is reserved for specific joints, like the spine, ankle, or wrist, where eliminating painful movement is the goal, even at the cost of flexibility in that joint.
It's so important, though, for listeners to understand that these more intensive treatments, particularly surgery, have both upsides and downsides.
Absolutely critical. The potential benefits are huge: major pain relief, getting mobility back, better function, often long-lasting results with replacements, a real life changer for many.
But the risks?
You have to weigh them carefully. Any surgery carries risks: infection, blood clots, anesthesia complications, nerve damage. Joint replacement involves a significant recovery period. There's a small risk the implant could loosen or wear out over time, needing revision. Fusion means permanent loss of motion.
So a very thorough discussion with the surgeon is essential.
Absolutely. Understanding your specific situation, the exact procedure, the expected outcomes, and all the potential risks and benefits is key before making any decision.
Okay. Living well with arthritis. It's not just about the physical side, is it? The mental aspect is huge.
You're absolutely right. Dealing with chronic pain day in, day out can really take a toll mentally and emotionally.
How so?
It can lead to feelings of frustration, anxiety, sadness, even depression, feeling isolated if you can't do the things you used to enjoy. And it can become a vicious cycle.
Because stress makes it worse.
Exactly. Stress and negative emotions can actually increase inflammation and make the pain feel more intense. So paying attention to your mental health is just as important as managing the physical symptoms.
What helps on the mental health front?
Staying connected is really important. Talking to friends, family, maybe joining an arthritis support group online or in person. Don't underestimate the power of talking to a professional therapist or counseling.
CBT, maybe? Cognitive behavioral therapy.
CBT can be very effective for learning coping strategies for chronic pain. And practicing mindfulness, things like meditation, gentle yoga, deep breathing, can help calm the nervous system and change your relationship with the pain.
Let's talk daily habits. What simple things can people build into their routine to help manage symptoms and just live healthier with arthritis?
Starting the day with some gentle stretching can make a big difference in easing that morning stiffness. Building in that regular low-impact exercise, walking, swimming, cycling is key.
Breaking up sitting time.
Definitely. If you have a desk job or tend to sit a lot, make a point of getting up and moving around frequently. Using assistive devices where needed, grab bars, ergonomic tools, maybe braces or supports for certain joints can reduce strain.
And using heat or cold as needed.
Yeah, having those readily available to apply when a joint feels stiff or sore can provide ongoing comfort throughout the day.
We've touched on diet a few times. Let's just recap the key things to focus on for eating for joint health.
Okay, key takeaways. Aim for those omega-3 fatty acids, fatty fish, flax seeds, walnuts. Pile on the fruits and vegetables, especially the brightly colored ones like berries, spinach, broccoli. They're packed with antioxidants.
Whole grains.
Choose whole grains like brown rice, quinoa, oats over refined white versions. Don't forget anti-inflammatory spices like turmeric and ginger. And use healthy fats like olive oil. Basically a varied, plant-forward diet.
And finally, protecting your joints during everyday activities. Any practical tips there?
Be mindful of overuse. Listen to your body. If an activity causes sharp or increasing pain, ease off or modify it. Pay attention to your posture, sitting tall, standing straight, lifting correctly, using your legs. Shoes matter. Supportive shoes with good cushioning can make a big difference, especially for foot, knee, and hip pain. And look for ways to adapt tasks. Use long-handled tools to avoid bending. Adjust your chair or desk height. Use lightweight tools if possible. Small changes can add up.
This field is definitely evolving. Let's look ahead a bit now. What emerging treatments and future directions are generating excitement in arthritis care?
It is a really hopeful time for research. Stem cell therapy is getting a lot of attention.
What's the idea there?
The hope is that stem cells, which can be derived from various sources like bone marrow, fat tissue, or donor tissues, could help regenerate damaged joint tissues, like cartilage, and also reduce inflammation.
For which types of arthritis?
Mainly being studied for osteoarthritis, but also exploring potential in REA. Early studies suggest it might help with pain relief and function, possibly delaying the need for joint replacement. But
more research needed.
Definitely. We need more large-scale, long-term studies to really understand its effectiveness, long-term safety, and who might benefit most. There are potential risks like infection or, theoretically, tumor formation that need careful evaluation.
And PRP therapy we mentioned earlier, that's also considered emerging.
Yes, platelet-rich plasma therapy fits here too, using the concentrated platelets from your own blood rich in growth factors to potentially stimulate healing and reduce inflammation, particularly in osteoarthritis. It's less invasive than surgery, uses your own biological material, so low risk of rejection or infection. It might help stimulate cartilage repair and improve function. Again, more research is ongoing to pin down its exact role.
And what about the broader field of regenerative medicine?
That's really the overarching goal, not just managing symptoms, but actually repairing and regenerating the damaged joint tissues.
Using what?
Using biological approaches, stem cells, growth factors, maybe even gene therapy down the line to try and regrow cartilage, restore joint function. It's about fixing the underlying problem.
Sounds amazing, but early days.
Very promising, but yes, still largely in the research and development phase. There are challenges, including potential risks like infection or immune reactions that need to be fully understood.
What about developments in medications? Anything new on the horizon?
Oh yes, research is constantly ongoing for new medications, especially biologics and other targeted therapies.
For inflammatory types, mainly.
Primarily for RA, PSA, ankylosing spondylitis, the inflammatory types. The aim is to develop drugs that are even more precise in targeting the specific molecules or cells driving the inflammation, hopefully leading to better control, less joint damage, and improved quality of life with fewer side effects.
And lastly, personalized medicine. We hear that term a lot. How might that apply to arthritis?
Personalized medicine holds huge potential here. The idea is to tailor treatments based on your individual genetic makeup, specific disease characteristics, and overall health profile.
How would that work?
By understanding your genetics, doctors might one day be able to predict how your arthritis is likely to progress or which specific medication is most likely to work best for you with the lowest risk of side effects.
So, more precise and effective treatment from the start.
That's the goal. Moving away from a one-size-fits-all approach towards treatments that are truly individualized for better outcomes.
Wow. So we have covered a huge amount of ground in this deep dive, really, from understanding the basics, the types, the causes, right through to current treatments and even a glimpse into the future.
We really have. And the main takeaway, I hope, is that while arthritis is often a chronic condition, it doesn't have to mean stopping living your life.
Right.
Proactive management makes such a difference. Those lifestyle changes, home remedies, the medical treatments we have now, plus staying informed about what's coming. It all offers significant hope for staying active and fulfilled.
And it's so crucial, isn't it, for you, the listener, to take this information and use it as a starting point for a conversation with your own doctor or healthcare team.
Absolutely essential. Your situation's unique. Discussing your specific symptoms, your health history, and the treatment options we've talked about will help you create a personalized management plan that's right for you.
Okay, and to wrap things up, here's a final thought to maybe mull over.
Given everything we're seeing with regenerative medicine, just imagine for a moment. What if future arthritis treatments weren't just about managing symptoms, but could genuinely focus on healing and rebuilding our joints?
What new possibilities, what activities might open up for you in the years ahead if that became a reality? Something to think about.